All right, hello and welcome to the first episode of the Paleoconnection. I'm Brandon and I'm joined here by my colleague Verv. Before we start the conversation on the topic of the COVID-19 crisis, we want to just begin with a short introduction about the premise of this show. The Paleoconnection spawned from the desire of Verv and I to delve deeper into some topics that shape the world we live in. We're just two normal guys that share a common interest in politics, religion, and history, among many other things. So we decided that it'd be beneficial to record our conversations as a way to preserve our own ideas for future consumption, with the added bonus of perhaps gaining a few listeners. The discourse will typically be carried out by way of a casual, unscripted demeanor. Many of the topics discussed are going to push boundaries of the Overton window, not because we necessarily hold the views, but because we want to explore them and gain a better understanding of why they may or may not hold true. Future episodes will also feature guests from around the political spectrum in the world to try to bring some diversity of opinions that is sadly lacking in the media today.
So we ask that you understand that some of the things we say may be controversial and may even be designed to get a rise out of you, but ultimately they are not said with malice or a desire to encourage people toward any extreme conclusions or opinions. It's just a show, and shows should be entertaining. So take everything with a grain of salt.
All right, so with that said, let's get on with today's discussion. And today's discussion is a very fitting one, the COVID-19 crisis. Verv, what do you think about Korea's response?
It's been one of the best in the world. You could argue that some of the numbers out of Germany look, really amazing. And as we'll discuss a little bit later, there is a difference between the European and Asian strains of the virus. But, generally speaking, what Korea has done is rightfully being envied all around the world. What do you think about it?
Yeah, I agree. I was a bit afraid at first when the crisis first happened, just knowing how Korea, and especially the Seoul area, there's so many people living on top of each other. I was a bit worried that the virus would spread like wildfire, but you got to hand it to the government here. They've done a great job. Everybody knows the tracking system that they've kind of put into place. The envy of the world. A lot of U.S. media outlets are praising Korea, and yeah, we have to give the props where they're due. They have done a wonderful job. Do you have anything else to say about what the Koreans themselves think?
Yeah, it was quite interesting how in the very beginning, President Moon was really getting harangued by the conservatives especially, but many Koreans as a whole, because there was no blanket travel ban on the Chinese.
Mm-hmm.
And one of the funnier moments was actually when Korea started really getting its own big wave of the virus, and you actually saw China start highly regulating travel from Korea. It was really an ironic moment, and I distinctly remember in that moment many Korean conservatives really going nuts over it, and kind of rightfully so. If the situation would have gotten worse in Korea, they would have really looked foolish taking the stance of, taking the higher road, as you would say, by not allowing by allowing people from all over the world to keep coming in, and then China, shutting down their travel. There was even an incident where one of the major Chinese air companies, I believe it was Far East, what is it? Far East Air, something like that, had actually laid off almost their entire Korean staff because of what was going on. Yeah, yeah.
Hmm.
Another interesting point I'd like to bring up as well is that, which we really haven't been having that vigorous of a lockdown. I've been going to work a lot. My gym has been open this entire time. My church was basically closed down for a while there, but while that was all happening, I was going to the gym. What has the lockdown been like for you?
Well, I have a teaching job in the mornings, and as you know, all the public schools were shut down here, and they have been for some time. They actually just recently opened up. but again, actually, I guess they might be closing down because of the Bucheon cluster that just happened. But I was doing Skype classes for over 2 months with my students. I teach at a small private school, so thankfully I was able to work, be it all. But 2 weeks ago, I started going actually back to work. It's in the Gangnam area, so this is in the middle of Seoul. For those of you who are listening who don't live in Korea, people here, almost everybody wears masks. They have a mask-wearing culture. I think the rule is now you can't even ride public transportation without a mask.
That's right.
That's
Yeah.
something that has just gone into effect. And if there isn't a strict mask rule, then you'll get perhaps some angry stares, people looking sideways at you in Korea, because it's sort of just understood here that the thing to do to protect yourself and others is to wear a mask. That's obviously different than in the U.S. and other parts of the world where some people are actually rebelling against masks. But the Korean people, and that's one of the things I really wanted to say that really separates them, I think, from the U.S. and it's kind of an East Asian culture thing, is the way that they come together in times of crises. You were saying that there was typical partisanship bickering between conservatives and liberals when the outbreak first happened in Korea, but then they all start to kind of coalesce. At least there's a general understanding of, okay, we're all Korean. We need to get through this together. And that kind of attitude is, something that, Korea has had to rely on for thousands of years, between having to geographically be between Japan and China. It's just something that they've kind of gotten into themselves, into their nature. So that's something that we can't underestimate. And it's really part of the reason, I think, why Korea and other East Asian countries have, been so successful in their containment of the virus.
That's completely right. It's also, we can't underestimate the fact that Korea got really lucky in the beginning because the outbreak was largely in the Shincheonji cult. Something, a lot of people don't really think about it, but they were very lucky because the members of this, well, we have to call it a cult. It really is one. Yeah. They basically spent something like 10 plus hours a week mandatorily involved in church activities, whether that's being at the church or being in these study rooms, etc. So they don't have that much contact with people outside of the cult who aren't, say, their family members and co-workers. Yeah. And it was also really, really a blessing in the sense that they do have membership lists. So right away, they basically started testing everyone.
Exactly.
Yeah. And it really was beneficial for the epidemiology of it.
Yeah. As we said, the testing and tracking has been definitely one of the positives here in Korea. And just wanted to briefly tell you guys that I actually was tested about 2.5 months ago. I had a low-grade fever, and I had just terrible fatigue in my arms and legs, and I thought that perhaps I had the virus. So, one of the great things about the Korean medical system is I was able to just call a number, and I was able to even speak in English to a representative who asked me questions to try to determine if I had the virus or not. And based on the questions that I answered, they decided that I should go get tested. So there was two options in the place where I live. I'd have to go to one of the hospitals or a drive-in testing center, which I believe Korea also may have invented. If they didn't invent it, they put it into place pretty quickly, which was pretty ingenious. I didn't qualify for the drive-in one because I think that was for really what they deemed as severe cases. So I did actually get tested at one of the hospitals. Now, this is actually one of the things that I think wasn't done quite up to my expectations. And what I mean by that is when I got to the hospital, they had sort of like a medical tent in the back of the hospital, not actually in the hospital itself, but kind of connected to it. So you never actually go in the hospital. But the medical tent was sort of right next to a side street where people were coming and going about their daily business. And when I first got there, I had to fill out some information. There was doctors and nurses in full biohazard suits, which of course was good. But the problem was that me and all the other people who were waiting to get tested, we were just loitering around the street area. Like
Oh,
we were distancing ourselves from each other. We kind of like when I first got there, I saw these people just standing around. I'm like, okay, what are they doing? I quickly realized that they were also waiting to get tested, and we were all kind of just, distancing ourselves from each other, but at the same time, walking in between us, there was people walking in and out of the street. I thought it was done a bit nonchalantly, and I thought they should have had that area like corded off, like where nobody could
right,
even like
right.
walk through there. But the way the testing works was I went into a tent, talked to a doctor. He was also in a full biohazard suit. He asked me some questions, and then afterwards he asked me, well, do you actually want to get tested? I said yes. Went over into another tent. I had two tests done, one where I spit into a little vial, and another one where they stuck a tube down my throat and my nose.
Oh,
And yeah, that one kind of hurt a bit. And then I paid. The cost was around 250,000 won, I think, which is a little under $250. And I ended up having to pay it because I ended up testing negative. Now, in Korea, if you test positive, that fee is waived. Um,
right, right.
but even though it wasn't waived, I think you can agree that was a pretty reasonable price, right? Like, I
Yeah,
heard
yeah.
like horror stories of $1,000 tests or something in the U.S. I don't know if those are even true, but a test for around 250 bucks is reasonable. And yeah, that's my story about my own COVID-19 experience. Thankfully, I'm negative, but there were some positives and negatives, I think, of the way Korea was treating the situation. But yeah, overall, there's not much to complain about here. I think we definitely live in one of the best countries to live in for this crisis.
Right. I actually also got tested 2 weeks ago.
Oh, really?
Yeah, it was because I actually was in Itaewon right around the same time that the guy who was at the clubs had went out
Oh,
there and eventually
you,
tested positive.
you
No,
didn't
I
hit any of
wasn't at
those
any
gay
club.
clubs? No,
No,
no gay clubs?
I was not. I was not at any clubs at all, gay or straight. It was it was really odd in the sense that I had gone there to go to an Indian buffet, and
Okay.
because there's some Indian restaurants around where I work, but I specifically wanted to have an Indian buffet and catch up with some friends. And I remember being very disappointed that because of the coronavirus being in full swing and not there being many customers, the
Yeah.
buffet was basically canceled.
Well,
So,
I actually have something to comment on with that too. After that whole Itaewon incident,
huh,
my school and a lot of other guys I know who do work at schools, their bosses were asking them if they had been to Itaewon. It's kind of funny.
right,
Um, People assumed that every single foreigner in Korea had been clubbing in Itaewon over that
that's right.
weekend, and we were all asked that like the following week by our employers, which is kind of funny. I kind of understand where they're coming from. There might be some mild racism involved in that, but really they're
Right.
just looking out for themselves, and especially with schools. Like I understand parents probably call up the schools and say like, do you know if your foreign teacher was in Itaewon? Yeah, if they were, I don't want to send my kid to school. So I guess you can kind of
Right.
understand that perspective.
I had a friend who's I don't know exactly. Well, I won't reveal exactly where he is, and I actually don't know exactly where it is either. It's somewhere in the countryside, and he was saying that there were actually he's married with children, but there were actually phone calls from parents asking if he's gay, and was in the clubs in Itaewon.
Wow.
So kind of
Yeah.
uncouth.
Oh yeah.
Uh,
I've heard stories of guys like 60-year-old grandfathers who are living in Busan who were asked if they went clubbing in Itaewon over that weekend. I mean,
right,
family men, grandfathers. So
right.
they
And
were
you're
just,
wondering
I
what
guess,
they're,
covering themselves for that. They just wanted to
yeah,
make sure that everyone was safe.
yeah. Well, because of that, I got all these messages that had notified me that if you were in this area, which I was, I assume they must have just tracked my phone. So I just called the number they gave me. I said the date and time I was there, and they told me I could get a free test, no questions asked or whatever.
Really, a
So
free test.
yeah, it was totally free. Me and my fiance both went there. It was a really short, quick experience, very similar to yours, except almost nobody was there. This is
Hmm.
there was no one in the Sungnam area really getting infected with it.
Hmm.
So while I was there, we literally had to call. It was a Saturday. We literally had to call them when we arrived. They came out in biohazard suits, and yeah, they asked just a couple things, and then they stuck it so far up my nose. I didn't even know you could put anything that far up.
Yeah, it hurts.
It really does. I thought they were going
Uh-huh.
to touch my brain,
I
and
know.
and then they did it in
What?
the throat, and then
Yeah.
that
Well.
was it.
Yeah. Well. Good
Interestingly
thing.
enough, they had told me, like, oh, you don't have to be quarantined at all or anything, but Koreans are so vigilant that I was told by my company I should work from home because of it. So,
Uh-huh.
there's a real, on a private citizen basis, there's a lot of people who will insist on, better safe than sorry.
Yeah. Again, I think it's one of those comparisons you can make to the U.S. that here in Korea, again, it's a more socially cohesive nation. People are more willing to self-quarantine. People are more willing to just follow orders, I guess you want to say. Whereas in the U.S., I
That's
guess
right.
there's a bit more rebellion, individuality, where people kind of refuse to do that sort of thing.
That's right. And
Um,
I think wearing the masks has made the difference overall.
mhm. Which was another thing that I believe it was the World Health Organization who's also been wishy-washy on the usefulness of masks.
That's
Um,
right.
they originally said that masks don't really do anything. In fact, they could actually uh, work against you by, since like you're touching your mask and you take it off and, you kind of just put it on a table or,
Right.
like you could actually spread the virus more easily by wearing masks. I heard things like that. And I believe that was from the World Health Organization a
In the
couple months
CDC.
ago. So,
And the
yeah.
CDC didn't change their tune until maybe a month ago. So we spent quite a long time with average people being told not to wear masks,
Hmm.
which kind of leads us to segue into the next big field of discussion, which is COVID-19 in the U.S. and around the world.
Okay, yeah. So, how would you grade the U.S. response so far?
I would say that it's not necessarily, obviously, it's not been as good as the US. And if you look at just the numbers, it's not been as good as Germany. But generally speaking, we are doing better than a lot of these European countries, it seems.
Exactly. I mean, if you look at the stats, we have been. Um, yeah, my opinion, the U.S. response, I would give it maybe a C or a B. Um, the
Sure.
problem is, and we're going to talk about these things a little bit later, it all just seems so early still in being able to truly assess the situation. Um, we don't know all of the variables. Right now, there's just a lot of politics being played,
Right.
and this is going to be something that is going to almost have to be looked back on 10 years from now to get a true judgment of how well, the U.S. and Europe has done. Uh, how do we? That's the thing too. How do we actually rate how well the U.S. has done? Do we rate it based on the deaths per million? Do we rate it based on um, what Trump says on Twitter? Do we rate it based on the strain of the virus that potentially the U.S. is dealing with in Europe compared to other countries? It's hard to really say how we're going to measure this, but I will admit that Trump, his messaging has been too he hasn't stayed the course with a certain message.
Sure.
And that's basically Trump's character. He does he changes his mind, and you don't get a lot out of him that's lasting.
Yeah.
That certainly could be something that was improved. But at the same time, as we're gonna, read some quotations here, he was fighting against the media and the Dems, the Democrats, because they were saying he was racist, right? They were saying he
Right.
was xenophobic, things like that. Um,
They would
I
actually latch on to anything that he would say at all. And if he's basically trying to give hope, they would make it sound like he's not being serious enough. And when he was proposing real strong policies that would have helped in the beginning, such as closing down a lot of travel, it was just being called racist. I mean, he couldn't win no matter what.
yeah,
And
exactly.
that's kind
Yeah,
of been the story of it all. So, should we start looking at some of the numbers here?
yeah. Let's look at some of the numbers. So some of the numbers here, the U.S. has um, total cases, about 1.8 million total cases, um, which is number one in the world, right? The U.S.
Yep.
has the most cases and also has the most deaths, about 104,000 deaths. So if you look at those numbers strictly um, by themselves, yeah, it doesn't look very good for the U.S. Um, but if you start comparing them a bit to Europe, um, it doesn't look as dire. Um, I did some calculations, and so the total cases for EU countries only. So this European Union countries. This is not including Russia, who actually has a lot of cases too.
Right.
There's approximately 1.5 million total cases in the EU, compared to about as I said, 1.8 for the U.S. And total deaths in Europe are more than total deaths in the EU are more than total deaths in the U.S. Europe has about 165,000 deaths right now. The U.S. has just over 100,000. Now, yeah, if you compare population sizes, I believe the EU is somewhere around 450, 500 million. The U.S. is about 350 million. So they're they're comparable. I mean, the numbers
Right.
aren't that different. Uh, in the deaths, there's about 65,000 more deaths in Europe right now. But
That's right. And
yeah,
you
do you
look at some
hear
of
much
these,
about that in the media? I mean, I haven't.
very little, these
Yeah,
per capita statistics really go out the window when it doesn't serve the people who are interested in, bashing Trump and doing little else.
exactly. Yeah. Yeah, when you look at the total deaths per million, um, the top 20 out of 25 are in North America or Europe. Uh, the top 10 is the top 10 is pretty much all Europe. Um, so total deaths per million, Belgium is number one. Spain is number four. the UK 5, Italy 6, France 7, Sweden 8, the Netherlands 10, Ireland 11, and then finally you have the US at 12. And we hear all the time about the healthcare systems in these Western European welfare states and how
Right.
they're the envy of the world, right? So what's going on here? Why are there more deaths per million population in these wealthy European welfare states with some of
Right.
the
And
best healthcare in the world?
that's right. And I think it's really an issue where people have confused the cost with the actual level of treatment that they're getting. They just think, oh, because it's free, they have such a great developed system over there. But as far as Italy and Spain and France and many of these countries have performed, it's not really impressive in the least. I guess you could say you get what you pay for.
Yeah. I mean, Belgium has 816 deaths per million population. The US has 316. So it's more than twice as many. Um, how many times have you heard something like that in the media? I mean, are people talking about? I mean, I don't even know who the president of Belgium is. Do you?
I
Are
don't off the top.
people daily, asking him to step down? Are people talking about how the culture itself, is failing? How people in Belgium can't social distance? How people in Belgium, can't wear masks for the good of their own people? I mean, we
Right.
get news stories daily about how, Americans are just performing terribly in this time of crisis. But yeah, what about Europe? We don't hear about that. We don't hear about how Europeans, wealthy Europeans, are from liberal countries. We don't hear about how they're performing so badly.
That's right.
Does Spain, does Italy, does France, does Sweden, do we need to, get rid of the whole government system and start over from scratch over there too? Do they need to just shut down their healthcare systems and start from scratch as well? You know, these are the kind of things that the kind of critiques that are being made in the media for the US, but and even people, I even see Europeans on Facebook from like the UK and Ireland, talking trash about the US response, but just look at the stats here. Their countries are performing even worse.
That's right. I don't want to even get that much partisan about it because I think that you end up with countries dealing with different situations. For instance, Italy's famous for having such a highly aged population and
Of
being,
course.
a tourism capital of the world, lots of people in and out. So,
Hmm.
I don't really want to go there necessarily and cheer on that we're doing, better because at the end of the day, a place like Montana is going to just be less affected by this than New York or Rome. But,
Uh-huh.
because of the response that we've been getting, where everyone is trying to use the crisis to their advantage as a political football, um, you kind of do have to go there and you do have to discuss the numbers and take a more objective look on what's going on. And when you do that, the numbers just don't add up to what people on the left are saying.
Well, you're exactly right. You're saying that there should be nuance in this conversation. For example, when you think of Italy, you should say, okay, yeah, their population is aged, they have a lot of tourists, that kind of thing. But again, are those types of nuanced conversations happening with the U.S. as well? The U.S. also has a ton of international travel. Um, Now the U.S. doesn't have the aged population, but the U.S. most of the problems in the U.S. have been in large cities like New York City that have a lot of international travel, and um, it's almost as if it was impossible to prevent. But we don't get that kind of nuanced conversation in the U.S. Um, like we just did with Italy, for example, or for France, or for
That's
Sweden.
right. The problems suddenly have nuance when we talk about a country that isn't the US. I recently read an article from Alan Dershowitz, and I guess it's an old proverb, but when things get partisan, nuance is the very first thing to die. And
Yeah,
you really see that with the coronavirus.
exactly.
I
Um,
can't believe we're already 30 minutes in.
yeah, we are.
So yeah, we should pick it up a little bit.
Yeah. Well, let's talk a little bit about some of the just overall in general the successes and the mistakes that we think the U.S. has made, and then we could kind of shift a little bit. Um, so the
Sure.
U.S. There was a lot of talk about flattening the curve. That's something that the U.S. has accomplished, and I believe we can put some graphs in the YouTube uh,
Definitely.
video when we actually upload this. Also, ventilator surplus. The U.S. I guess what the U.S. does best is it produces a lot of products like ventilators if it needs to. The U.S. produced a surplus, so I guess we can perhaps sell those abroad, maybe to other countries. But that was another success. Hospital capacity has been another success, and then there's a various assortment of treatments that the U.S. has come up with. Some of those have been criticized for Trump, overplaying them. There's also some vaccines that are in the works. So those are some of the
Right.
successes that the U.S. has had. As far as mistakes, while those overhyped treatments, I guess you can say, would be one of them. Lack of the mask supply. Now, this is something that believe it or not, actually partially can be blamed on the Obama administration. So it is, in fact, true that the national stockpile of N95 masks was depleted by the Obama administration due to a few health crises, one of them being the Ebola one that happened, I think, around like 2012 or so, right? Um, but the Obama
Right.
administration did not actually replenish those N95 masks. And there were experts at the time that called for a replenishment. And for whatever reason, the stockpile was never replenished. And another problem with getting masks was that many of the masks these days are made in China. And getting masks out of China at this time was, hard, very difficult to do for
Right.
obvious reasons.
We saw a lot of discussion about how when this is all over and for the long term, we have to bring particularly medical manufacturing and things like that back to the US. Because even
Definitely.
just some of these over-the-counter antibiotics and things that people, use fairly frequently, especially if you do have kids, are actually being manufactured by China, which, we can't say that they're an enemy by any means, but it's also true that we wouldn't necessarily consider them a reliable ally or somebody that we
Oh,
want
yeah.
to be intertwined with going forward.
I mean,
Um,
yeah, let's be honest. There's practically a Cold War going on right now between the US and China. Now, it's not like it was with the Soviet Union back in the day, but I mean, things are getting very, very touchy, and it would definitely be beneficial to move some of that manufacturing, like essential manufacturing, like medical and obviously anything military based, to be just, you know, back domestically in the U.S.
Right. And not only does it benefit our own economy, but it'll also result in perhaps pressuring the Chinese to improve their human rights record.
Oh,
With
yeah.
that, I had also seen some news that Japan was actually incentivizing their companies to relocate from China, not even necessarily to relocate back to Japan, but just to get out of China. So
Exactly. Yeah, I
even if you're
saw
not a
that
big
too.
fan of, yeah, even if you're not a big fan of Shinzo Abe, that's definitely one of the things that we could look to as a good example of what we should consider doing.
Yeah, we got to start looking at other options. Vietnam, India, India obviously the obvious option there. But I think the world in general is kind of using this crisis as a moment of reflection and just looking in the mirror and saying, do we want all of our manufacturing over in China? Do we want to be so reliant on China as we have been? Because, a crisis like this happens and the whole world's economy gets thrown into a loop. And yeah, who knows what the future holds, but, economies around the world are crashing.
That's right. And China is not someone who we can rely on to be honest in their reporting. As it's been pointed out by Dr. Burke, I believe her name is. The name
Okay.
escapes me, but she was saying that so much of the initial response to the coronavirus was based on faulty numbers coming out of China, and that we were not taking it seriously enough, partly because the Chinese situation wasn't being accurately reported.
Yeah. And also to add to that, according to the Wall Street Journal, there's been Chinese hackers that have been targeting American, like right now, like as we speak, targeting American universities, pharmaceutical and healthcare firms, trying to steal coronavirus treatments and vaccine information and private information of people who've gotten the virus in the U.S. I mean, so while we're dealing with this crisis, we're dealing with Chinese hackers, intruding upon and potentially endangering American lives by hacking into these institutions. It's really quite astonishing that this type of information isn't reported more. Um,
That's right.
yeah,
China has not only been doing that, but also been cheerleading themselves whenever they send aid to anyone else, and it's usually faulty aid. There was the case of the masks that didn't work at all in, I believe it was the Netherlands, the tests that didn't work at all in Spain. I saw
hmm
video footage of some nurses in a hospital in France taking out the Chinese PPE that was literally falling apart in their hands. It
yeah,
was honestly pretty shocking.
hmm
And on top of that, you've got not only just the hacking, but there are official news outlets that are advancing conspiracy theories that the United States actually planted the virus in China and that it doesn't come from China at all, but rather was our covert operation targeting them.
yeah, yeah. Well, that was, I believe, an official communist CCP official came out with that information, and that was, I believe, right after Trump, the whole Chinese virus, fiasco was going on, where Trump called it a Chinese virus, and then China responded by, floating conspiracy theories that I believe the U.S. Army, you know, put the virus in Wuhan and tried to spread it. Which, I mean, come on, how does that make any sense? Anyways, you know, the U.S. spreads the virus in China for it to only come back to the U.S. and greatly hurt the U.S. It's just a ridiculous conspiracy theory that was floated by, you know, senior government officials in China. Um, but the truth is, the real interesting conspiracy theories are the ones that have to do with where the virus actually came from in China, right?
Right.
Why don't you
There's
talk a little bit about those?
right. There's far much more merit to the idea that potentially it did escape from a lab in Wuhan. Um, for instance, oh, I'm drowning here. I'm sorry. But okay, I was going to say though that Senator Tom Cotton actually became famous for advancing this theory back in February, but he was, ultimately accused of dabbling in a conspiracy theory here. However, there's a lot of reason to believe that there can be some truth to the idea that the virus could have escaped from a lab in China. There was a lot of research being done by a man named Niko Petrovsky, a scientist at Flinders University in Australia, who talked about how the virus's unique ability to bind to human cells far exceeds the similar properties that they have in for infecting other animals. And so it doesn't look like this potentially went through the normal course of evolution and then jumping into animals.
Exactly. Well, and there's two real conspiracy theories there too, and one of them is that it was a natural virus that just escaped from the Wuhan lab, right? So that's one theory, and the other one is that it was an artificially made virus that escaped from the Wuhan laboratory. Now, yeah, both of them could be possible. I think it's more likely that it was perhaps a natural virus that escaped from the Wuhan lab, but unfortunately, we're probably never going to know the truth, because from what I've read, much of that data has been destroyed by the Chinese government, and many of the people that worked at that lab have been silenced. Obviously, there's no free press in China, so it's not like they're going to go digging for the truth. So we're probably never going to actually know, and that's part of the problem here, is that since we're not going to actually get a paper trail, these conspiracy theories will definitely fester, and take a life of their own, as this virus continues to wreak havoc.
That's right. And one of the ironies as well, I'm getting this from the article from Michael Rubin, is that sometimes these things that really get dismissed as conspiracy theories have actually been later documented to be the truth. Right when I think about a conspiracy theory that's been proven true, I think immediately of course, of Jeffrey Epstein.
Yeah.
Forever on Twitter, you would just see these random posts about this guy that they said was so important and embedded with all these people, rubbing shoulders with President Clinton and all of them, and that he was this pedophile with, this island where he'd fly people out and they would have, crazy devilish sex parties. And it just seemed like all this hot air. But ultimately, the guy literally is indicted. It comes out that there were these other charges that basically were pled down and swept under the rug. And honestly, I've now had to reassess how I viewed conspiracy theories, because this proved to be so true.
Exactly.
There's also this great parallel of an event that happened in the Soviet Union, where witnesses had claimed that there was a disease being spread through inhalation, and that it could have been through anthrax or some kind of bioweapon. However, the Soviet Union had kept saying, "Oh, this is just a conspiracy theory. This is just something that resulted from tainted meat." But it's only afterwards, that when all the dust clears a decade later, that you have President Boris Yeltsin acknowledging that the Soviet Union did have a biological weapons program, and ultimately what had happened was related to this bioweapons program. So It takes a long time for truth to come out. It could be a situation where decades later it will come forward that the lab in Wuhan actually was being used to experiment with bioweapons, and theoretically this could be a big mistake directly attributable to bioweapons being manufactured or developed.
Yeah, well, I don't think there's any doubt that the Chinese government has bioweapons, right? I mean, that's just something I think we can kind of just know that is happening. The question, of course, is what kind of bioweapons do they have? And kind of just to go way out there with the conspiracy theories, in the Telegraph, the British newspaper in 2019, they said that I quote, in a particular bad case, a bioweapon could be built to target a specific ethnic group based on its genomic profile. Also, we have a 2012 article from The Atlantic talking about a potential bioweapon, an ethnic bioweapon. The Atlantic puts forth the hypothetical scenario of a virus which causes a mild flu to the general population, but is specifically deadly to only the President of the United States. Now, of course, this particular scenario, we can probably say has not happened. However, it raises questions. If you do look at the global statistics of COVID-19 deaths, it is a bit suspicious as to why there are so many deaths in Europe and the United States. I don't know if it's just it's a data problem, or some countries are underreporting, but you've got poor countries around the world that you think this virus would be wreaking havoc in. Africa, India, for example.
Right.
But that has not happened. And I'm not saying that this has been specifically targeted at white people, but we have evidence that that type of weapon can be produced, and we do have some curious statistics at hand. So it makes you think about that, you know.
Yeah, and even the countries that are also up there suffering tend to be Latin American ones. And when you look at Brazil and Mexico, who are both putting up some, rather large numbers, I believe Venezuela and Colombia are starting to kick off too. These are populations that I believe the average person throughout most of Mexico has around 50 to 60% European genetics.
Exactly.
Right. And Brazil has a very large, of course, a very large black population, a lot of mestizos as well. But it's also a place where there are there's regions of Brazil and Argentina where you have primarily people of German descent and such. There's no lack of European enclaves or significantly European genetic populations.
Yeah, you could counter this conspiracy theory by bringing up New Zealand and Australia, which would be a very good point. But then at the same time, we do also know that there are multiple strains of the virus. And the strain that is running through Europe and North America right now is the more deadly strain. Perhaps the one in New Zealand and Australia is not as deadly. But yeah, who knows? Perhaps anybody could die from the virus, but maybe it does affect different ethnicities in different ways. That's something that, it's too early to tell. Perhaps we could find that information out in the future, but I thought that was an interesting conspiracy theory that was going around as well.
It could be intentional or even unintentional. For instance, there is a specific genetic marker found amongst Baltic populations and also some Scandinavians that makes something like, in certain groups, almost as much as 10% of the people actually immune to AIDS.
Really?
Yes, it's absolutely absurd when you hear it, that a group of people would basically be immune to AIDS, but that is the case. And even in those groups of, like, say, Russians and Belarusians and Lithuanians and Estonians, even in those specific groups around that area, it still only amounts to ever 10% of the population. So, like, no one's exactly going to play Russian roulette with AIDS in their genetic heritage. But it's certainly interesting to think about that.
Yeah, for sure. All right. So what do you think about, let's kind of wrap this up. What do you think about the future impact of COVID-19 on the world? I mean, do you think it's going to, affect the way we go to work for the rest of our lives, affect the way we, get our educations? A lot of people are saying that, there's going to be more working from home. Meeting in schools, we might just deem as unnecessary for a certain percentage of students. What do you think about that?
I think certainly we're seeing that working from home, while it does cause some amount of losing some of the control over your workers, I think it's generally proving to be a big success. I haven't had any issues with it. I've heard that I heard one teacher say that it's so much harder to teach over video. I don't work as a teacher. What do you think about that? Is it a lot
Yeah.
harder to teach over video?
It is more difficult in some ways, but of course, in other ways, it's actually better as far as being able to share your screen and like just having a computer that you're familiar with in front of you at home and being able to do some things online that you can't. Well, I mean, you of course could do with a projector in the classroom, but it all works faster and it's done more efficiently if you're just doing a video call. But like, making sure that your students are paying attention, obviously, you have no idea if they're, playing a game or something on their computer. That's obviously a problem. But I think that especially in Korea, perhaps, where Korea is a bit old school with, their work environment. And they like to have everybody come at a specific time and, you have to stay until the boss leaves and that sort of thing. I think this could impact Korea and in a way to make them a little bit more open-minded and lenient with working from home and that sort of thing. What do you think about that? You think it's going to change at all in Korea, the culture?
I think it's going to change less than it will in the West. At least from what I see from my boss, she was reluctant to have people work from home, and it seemed like it was worst case scenario type thing. So I'm guessing more Koreans will have this kind of attitude. The change will be slower here. But I can imagine that many Americans will now be looking at, potentially maybe not working entirely from home, but I think there'll be a lot more bosses willing to say, you know what, only come here 4 days a week or 3 days a week,
Hmm.
or even to incentivize it so that one of the perks can be, hey, after 5 years here, we let you, you only have to show up on Mondays and Wednesdays or something. I can see that
Yeah.
being something. And
Well,
frankly, it could also be something that bosses use to maybe not give you that much of a raise, right? Maybe your incentive is now you work from home, but you're not getting a 4% raise, you're getting a 3% raise.
yeah, I heard, that in the US and in the West, it's going to change the commercial real estate market forever. You know, let's face it, there are a lot of just office buildings that are really just not essential. Like a lot of people could be working from home when they're not. And I think what this crisis may end up doing is having companies realize that, yeah, we could downsize our office, let's pay for half the space and let's have our workers work from home, half of our workers work from home, and end up saving money that way. That's definitely a potential, future outcome. Right now, I have various family members who are, of course, working from home, and luckily they're able to work from home because there's certain jobs where you can't do that, but they're efficiently working from home and they haven't had any problems with it so far. So, yeah, I definitely see some changes in the horizon with, the old 9 to 5, you got to come to work and put your time in type of mindset. That was already kind of changing in the West, but I think this might push it over the edge a little bit and really, shift towards working from home if you can.
Right. And it could actually, I'm not talking about, next year or even 10 years from now, but we will probably start seeing people envision a world where, like, hey, I want to have a job where I maybe only work 3 or 4 hours a day remotely, doing Skype calls and sending emails, doing my work from home. And then, 3, 4 hours in the afternoon, I'm doing horticultural labor on my own small, self-sustaining farm here. We
Yeah.
we can see. how that would decrease pollution. It would decrease crowding. You'd have more people making more use of land, and it would probably just be healthier. We always talk about how overweight and unhealthy we've become because we live in cubicle culture where you eat processed food because it's cheap and you're too tired to cook. That sort of thing could get flipped on its head, and we could see some, a techno-agrarian future that we all kind of long for.
Exactly. I've heard you talk about this before, and it's actually a good time for us to stop because I think it would be a great topic for a next episode, another episode. You're kind of
Right.
envisioning here what Thomas Jefferson envisioned for America, the yeoman farmer going out there and being the backbone of America. He was sort of against the industrialization, and he thought that America should be an agrarian society. It's almost as if we could have both, perhaps, in the future.
Right. There was a philosopher. He's still alive. He's very old now. Oh, he has a hyphenated German name, so it's like two difficult German names crammed together with a hyphen. I want to say it's like Ludolf something or other, but he was saying that to really understand pre-modern Europe, you have to understand how there was some amount of contempt for being industrious because it was considered to be kind of a feminine thing to be really obsessive about, making everything orderly, making everything look nice, and kind of this natural disposition of the aristocratic man was to be like, I'm going to leisurely sit here and contemplate the universe, and then I'm going to go on a hunt later, right?
Exactly. You're exactly right, and that was also found in, for example, British literature, with like the Romanticism movement. This was about the time when the Industrial Revolution was taking off, and the poetry of the time period was looking backward at the times when you were able to live in the countryside. Living in the country was seen as the place to live. Nature was revered, and there was definitely a backlash against the Industrial Revolution at the time. And perhaps the future, is like we just mentioned, it is more agrarian, more like robots efficiently working in the factories, and we could be subsistence farmers again. Everybody's growing their own food.
Right. So we've basically hit an hour here. We have a whole lot of material we did not get to, so maybe we could even do something else more specific about the coronavirus down the line. Maybe we'll do something else for the next episode. Do you have any closing remarks, Brandon?
Well, yeah, certainly we have a lot of information, and I don't think the COVID-19 crisis is going away anytime soon. So I'm sure we could do another episode in the future. But I would just like to thank anybody who has made it to this point, listening 1 hour for our first episode, and invite you guys back again for our next episode. And we don't know the topic yet, but hopefully you give it a listen. So thanks for listening if you made it this far.
Yes, thank you very much, and everyone, take care. Signing out.